Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. You know that I am MD in Ayurvedic medicine and MD in Ayurvedic physiology. I work with a lot of team of the doctors like Ayurvedic physicians and the children specialist, orthopedic, and everybody is there who can master or who is a master in Ayurveda and also treating the patients. So under my guidance, this team works. We have the paid online consultation available. You can definitely WhatsApp me on 9226810630. The number is given in the description. My dear friends, in the series of Ayurveda in general medical practice, today we are going to discuss a very common problem or a common complaint which is called as a sciatica. Sciatica is a name given with the name of sciatic nerve that is spreading from the lumbar region up to your feet. So on either side, either left or right side, that sciatic nerve get compressed because of the vertebral column problems. The intervertebral disc is becoming degenerated, and then the bones they give the pressure on that sciatic nerve, and the typical distribution of the pain is there. So according to the spread of the pain, the doctor can diagnose that it can be the sciatica. There is a typical sign or a test also, clinical test, that is called as a straight leg rising test. Please write down straight leg rising test. Patient is asked to lie down on the bed, and then doctor will lift one leg slowly up. And if there is a typical sciatic pain, the person will tell, "Oh my God, doctor, please don't lift up because I am getting the pain at this particular points." So accordingly, the doctor can diagnose that it is a straight leg rising test and the problem is sciatica. It is usually unilateral. According to Ayurveda, this is the problem of Vata dosha and Majja dhatu. So try to understand that Vata dosha prakopak aharvya, especially dhatu kshayjanya Vata prakop, is responsible for such complaint of the intervertebral disc prolapse because of the degeneration. So to prevent these particular problems of Vata dosha, what is needed? A proper and wholesome diet is required, which is enough vitamin D and also what you can say the calcium and phosphorus. But at the same time, the patient should not have the hectic lifestyle, because too much physical labor or too much stress can exaggerate this particular problem. So Vata dosha prakopak ahar vihar should be avoided. The food should not be Vata prakopak, and lifestyle should not also disturb the Vata dosha. So oil massage, snehana and svedana is always the best treatment for Vata dosha. Of course, the medicated enema like the Shemula Kvath decoction enema is also best for such condition, especially Anuvasan and Asthapana Basti. Many patients ask me, "Doctor, you do online consultation, but do you have the clinics and hospital attached to your Ayurveda Academy?" Yes, definitely. And we also provide the Panchakarma oil massages in the different clinics and different hospitals. So if anybody is interested to come to Pune altogether and take this type of treatments, yes, you're always welcome. You can have the paid services available with Ayurveda Academy. Let us start to discuss about this sciatic nerve inflammation, that is sciatica problem. So what is basically the definition of this sciatica? Pain in the distribution of sciatic nerve or its component nerve roots. The syndrome means a group of the symptoms, is now accepted as being caused by a lumbar disc prolapse, intervertebral disc prolapse. However, sciatic nerve lesion can occur due to the pressure in the buttock or upper part of thigh. Let us see about the causes in detail. First is a true sciatic neuritis, which can be caused by the diseases like leprosy, polyarteritis nodosa, nerve injury due to the injection or trauma. This is most important. Doctor should take care when they are giving the injection in the buttock region. Very specifically try to avoid the injury to the sciatic nerve roots. Then post-herpetic neuralgia, mechanical pressure on nerve or roots or referred pain in the spinal cord. Tumors may be there, tumors of cauda equina, then arachnoiditis, rarely thrombosis, hemorrhage or infection, irritating meninges of the cord, spinal cord, meninges. In the cord space, that is a protruded intervertebral disc, extramedullary tumors. In the vertebral column, there may be arthritis, tuberculosis, spondylolisthesis, ankylosing spondylitis, primary bone tumors, and secondary carcinoma. In the back region, you can get fibrositis of posterior sacral ligaments. In the thigh and buttock region, there may be fibrositis, sacrosciatic band, hip joint or sacroiliac joint diseases, neurofibroma, hemorrhage within or adjacent to the nerves, then sheath in the blood, dyscrasias, anticoagulant therapy, misplaced therapeutic injection. Yes, keep watch. Give very safe and perfect injection when doctor is giving on the, of course, this is the duty of doctor. I'm not talking about the patient. Okay. In the pelvis, sacroiliac arthritis or strain, hip diseases, infection of prostate or female genital tract, rectal impactions, tumors of lumbosacral plexuses. These are the different causes for sciatica. Now let us see what type of the investigations we can perform. X-ray, straight X-ray of lumbosacral for detecting the disc narrowing in lumbar spine or lesions of sacroiliac or the hip joint. Then myrography to localize the level of disc protrusion and to differentiate such lesion from the tumors as well. CSF may show the increased protein with normal cell count in large protruded intervertebral disc. Cerebrospinal fluid examination in the laboratory. EMG electromyography may be used to confirm presence of denervation in the affected muscles. Procaine injection test. This is done for diagnosis of fibrositis, pain. Contact with the needle aggravates the local pain and elicits referred pain. Procaine suppresses the both and freedom of the leg and spine movement is restored. Let us talk about the treatment of sciatica according to Ayurveda. Rule out the cause and give the proper treatment. Sometimes even in the emergency, we can do the traction. But in the normal condition, to prevent the further attack, ask the patient to do a typical yoga postures learned from the yoga teacher. Symptomatic treatment is Mahayoga Raja Gugulu because this is used in Amavastha as well as Niramavastha. Also, this is the best treatment for Margavarodhajanyavata Prakop as well as Dhatu Kshayajanyavata Prakop. Then Suvarnamakshik Basma, whenever there is hemoglobin problem or the less hemoglobin, 250 milligram. Tapyadi Lohavati also gives the nourishment to the majja or the nerves, 250 milligram. Then Gandharvaritaki Churna, 2 teaspoons with warm water at bedtime because Anulomana Chikitsa, Vatanuloman Chikitsa is very important. Another prescription, my dear friends, for sciatica. Gokshuradi Gugulu, 2 tablets 3 times in a day. Then Vata Vidvamsanaras, 1 tablet 3 times in a day. Gandharvaritaki Churna, 1 teaspoon with warm water at bedtime. Third prescription, my dear friends, from our experience and knowledge for severe pain, Suvarna Samira Pannagaras, 30 milligram only, Kurasani Ova 125 milligram as a tranquilizer 3 times in a day with honey. Then Rumanil ointment for massage and 2 tablets, Rumanil tablets 3 times in a day. Then Prasarini Tail for massage followed by the hot fermentation. Snehan Svedan is always better in Vata Vyadhi or Vata neurological problems or musculoskeletal problems. Strict bed rest on hard mattresses. This instruction is very, very important, my dear friend. Strict bed rest on hard mattresses, not on Dunlop. Do not carry heavy load or weightlifting is not allowed, and pelvic traction sometimes in emergency to control the acute pain is definitely can be taken help of even by the Ayurvedic doctors. So my dear friend, this is all about the sciatica management and sciatica disease. I hope that you are liking this series of Ayurveda in GP or general medical practice. I wish you all the best. But before that, again, kind request to subscribe my YouTube channel. Share this video to all your friends, doctor friends, and even the patients of sciatica. Thank you very much. Take care and see you in the next video. Thank you very much.